Welcome to Med Medicine with Miss P. Got lots for you today, but I'm going to try to make it quick, as I often do, because 15 minutes is long enough. Had a patient not too long ago that told me to my face that as I'm getting ready to give him the Tylenol that the doctor ordered before the procedure, that he can't take Tylenol because he had a hemorrhagic stroke. That's not the way. Tylenol doesn't have any effect on your hemorrhagic stroke, like at all. There's no correlation. But he said, but aspirin's okay. I said, no, you have that backwards, and it's really important that you understand that. You who have had a hemorrhagic stroke really need to know that Tylenol is the only thing you should be taking, and that you should really never even risk aspirin, ibuprofen, Motrin, Advil, Aleve, vitamin E, alcohol, fish oil, or any of the other things that make you bruise and bleed, seeing as how you've had a hemorrhagic stroke. And he thinks he's not supposed to take Tylenol. So when I explained, he just went like, "Oh, I don't know that that's what they said." They did. I have not had a stroke, and I can tell you that that's what they said. You probably don't remember because of maybe the stroke, but you shouldn't be taking aspirin, and I really hope you're not taking it at home. And his girlfriend or wife that was in there, she's all over him, rubbing his back, almost in bed with him before his hour and a half elective surgery that they think, I guess, is another stroke. Neither one of them understood the difference in how that works. Do you understand how important that is and how that works? Because that's huge. And he's completely got it backward. It's a little important, but okay. So another patient had written down that, or charted, that typed in that they had the gallstone removed down the throat. Okay. Now, I can't remember. I think this was a screenshot a coworker sent me. They had the gallstone removed from down the throat. That's what was typed in there. There's so much wrong with that. Now, I'm sure a lot of people don't understand, like a let's say, working engine, or even a tractor. I find that all, pretty fascinating, and I don't know that I could necessarily, you know, explain every working part. But to me, when it comes to your own body, you should have an idea what's connected to what, and that there is 100% no way, maybe there will be in the future, that you could go down through the stomach, through the intestines, and then to that specific portion where maybe the gallbladder is secreting bile into the, and go back in there and get a gallstone. Maybe that's a real thing now, and I just don't know it, but I don't think so. I'm pretty sure that that's not what's happening right now. Another patient who is insulin dependent, diabetic, they said they get hypoglycemic after food. They get hypoglycemic after eating. Then that means that you are over medicating with insulin before your meal. That's the only way that can happen, or you're not diabetic at all. I don't understand what people don't understand about diabetes. It's really not that complicated. Of all the endocrine secretions and squirting and the glands and all this stuff it does, like, diabetes is the only part that I actually can truly understand. And it doesn't seem that tricky. But I can promise you, if you get hypoglycemic after you're eating, you're overdosing yourself on insulin before that meal. That's the only way that can happen. Under surgery, a patient told me that they had basically cell carcinoma. Now, I know that's a typo because when I talked to him, he said basal cell, but just seeing that the basically cell in there, I thought was kind of cute. And he was a nice guy. He was on top of things for the most part. I just thought that was cute. Oh, and I wanted to throw this out there. Keep in mind, we're just making fun of some mistakes and some misnomers and confusion about the medical field. It's not like, oh, everyone's stupid and ha ha ha. I've done plenty of stupid things, and I've told you guys this before. I told students in the past. I may even have had it on a video before. Years and years ago, I used to work with this adorable little laser guy. He was so cute that when he was in the room, my IQ just plummeted. And we were talking about The Swan. Remember that show, The Swan? They would take like, I don't know, six hideous women. I mean, just poor things. Looked like they were on fire and someone put them out with a bag of nickels. Just hideous, hideous. Not just overweight. I mean, jacked up, just triple P's all the way. Just piss poor protoplasm, sad, sad, difficult looking people. Just very, it kind of reminds me of Drac looking at that little um, alien lady from Guardians of the Galaxy 2. Just the hideous women. So they would, do all kinds of plastic surgery, and if they needed to diet or whatever, they would do that too. So I was sitting there talking about it, Tim, and I was like, yeah, I mean, they don't. It's not a long period of time. And he's like, he goes, yeah, I think they do that in 3 months. I was like, I said, no, I think it's, he said, yeah, I think he said 4 months. And I was like, no, I think it's like 16 weeks. I said that out loud to him. And he just kind of looked at me a little squinty. And he may not have been the sharpest knife in the drawer, but he was smart enough to know that 4 months is 16 weeks. So, and I just said that to him. But in my defense, he is so pretty. He's so pretty. I just kind of. And then as I was getting ready to move states, kind of move into this little hillbilly town, we were talking about like how scary the Texas Chainsaw Massacre was. I'm like, yeah, I know. I'm like, it happened in, one of those states like that. I was like, where did it happen? And he goes, are you asking me where the Texas Chainsaw Massacre occurred? And I was like, yeah, I'm gonna go. And I had to leave because I just asked this boy where the Texas Chainsaw Massacre occurred. That's what I asked him. So we recognize people say and do dumb stuff. It doesn't necessarily mean they're completely stupid. You just have moments of stupidity from time to time. For instance, I just found out a couple of years ago, to my medical director's delight, because I am the bane of his existence, his words, that I was pronouncing laryngoscopy wrong. And I was pronouncing it wrong for 20 years. So that happened. And also, I recently found out that I have been spelling Afrin with 2 F's for 15 years. Been charting that in legal documents. Can't spell Afrin. So everybody does dumb stuff. It's just fun. We're just poking and having fun with it. In fact, one of my very, very intelligent friends, who is just it doesn't matter what you throw at her, this girl can catch it, origami it, and throw it back, and it's a lottery ticket. A winning lottery ticket. I don't know how she does it. She's gifted. She is way too intelligent to say irregardless, but she does. So that's just, I can look past it because she's smarter than that. So we all do dumb stuff, fine. But I just thought that was one of my favorite ones. Also, like real simple things. Like I always will tell them, and I try not to say it as if I'm being condescending, but I want them to hear me. So I say, and put the gown on opening to the back. And sure enough, dog hair, I walk in and there's like a little boobie slitting, just coming right through the little slit there. And I was like, no, go ahead and turn that gown around, because some of them, like, it doesn't even fit them. I mean, and they're usually big gowns, but if you cross over, it'll be like a robe, but they don't. They just, and like, or through the Holter monitor hole, a little nip is sticking out. And I'm like, hey, why don't you go to the bathroom while I get your paperwork ready? You can go ahead and turn your gown around, opening to the back. I'm like, oh, did you say that? I did. Just like when we say take everything off, and I noticed that they left their pants on after I said take everything off. Not their underwear, their pants, like they're straight up the jeans they walked in on, or their leggings. I'll say, take everything off, and as I, put something on the back of the bed, walk forward, they're sitting at the foot of the bed, I notice they still have the bra on. It's just one of those things. There's got to be like a little part of you that we're not doing a breast exam here. The gown opening to the front is when, you're having a breast surgery, or even then we actually don't have them put it on opening to the front, but maybe an exam at the GYN, you put that on opening to the front. And, this was one of my favorites. One of my coworkers who never screenshot stuff and send it to me, she literally had to do it because it was so painful. You can clearly see how it's set up to fill it out online if you're the patient. There's, it says medication, amount, time, dose, rate, frequency, everything. There's like 10 different boxes. It's more than it needs to be. It could really be tidied up. But in one box, this person wrote like all 10 medications, like paragraph form, makes no sense. Some had doses, some didn't. But it was so bad that there was nothing in there to help the spelling, because it couldn't even catch it anymore, since it was such a bizarre thing the way it was in here. So this one, I don't know if you're even going to be able to see this. Metro Polo. Marco Polo. Yep, that's Metro Polo. And then it just said twice a day. Oh, wait, I got a better one here. Here is, see if you can figure out which medication this is. And I'm not even exaggerating. That's Jardiance. You see the Jardiance? You like that? Jardiance. You mean Jardiance for diabetes? That's fantastic. Oh, and then this, I'm not even sure how they did this. And you know what? I also have no idea what that is. Acetalopram. Do you think that's maybe Tylenol? I don't know. Acetalopram. I got nothing. I don't know what that is. Okay, and then this one, I'm going to put it up here. I had to write it down word for word before I erased it. And I still, if she didn't tell me what it was, I would never have known what pyrosamine, Lasix. Yep, pyrosamine. I don't, and I said, I bet that phone call was really fun. Some of them were like, oh, I take it twice a day. How much? No dose. Or it said, 1 tablet a day. How much is 1 tablet? No, whatever you guess. And one time it said all 1 tablet. So that's how much the dose was. All of them are 1 tablet. And then they wrote in their correction, by mouth. And I guess one of them had a different route. So they wrote in their correction, instead of just deleting it, he wrote in there, oh, I'm sorry, correction, it's by mouth. In case you thought you were taking your Jardiance rectally or something. I don't know. Really, those were tough. Also, I don't understand. Every time we call someone, my little coworker was like, she hung up the phone and she was like swearing. Why do people after lithotripsy think they should be in pain? You understand that the reason you're having this procedure is so you don't have to go through the pain of passing a kidney stone. We shock wave it out. That's what an extracorporeal shock wave lithotripsy is. It's a sound wave, kind of a sonogram, it's extra outside the body, and it sends shock waves through there to bust up that stone, so much so that as you pass it, you don't feel it and it doesn't hurt. So every time we call the next day, they're like, well, I don't know if I'm passing anything, I'm not having any pain. Why would you have surgery if you were then going to have pain while passing a kidney stone? You would just stay home and I guess start pushing. You're not supposed to have pain after a lithotripsy. That's the whole point. They try to get in such tiny granules that you can't even strain it to see it because it's gone. That's why we do it. They all expect to be in pain. Like, I'm waiting for the pain. I don't understand. I spoke to somebody yesterday that had an abdominal ablation. Yep, they ablated the abdomen. I think she meant tummy tuck. I don't know. Turned out to be a uterine ablation, which, guess what? Uterus not in your abdominal cavity. It's like below your pubic bone, behind your pubic bone. But okay. This other lady, 59-year-old female, she was adorable talking to her. She was just a joy to talk to. She literally typed in under smoking, I kid you not, 2 blunts of weed a day. And this is how lame I am. I literally don't know what a blunt is. I'm thinking, Jay and Silent Bob. I guess I thought a blunt was a roach, the last little bit of a marijuana cigarette. I don't know. Now I sound like Lily Tomlin. Literally, I don't know. I don't know, but that's how much she smokes, and she's just straight up telling you. I don't even know if it's legal here. I guess. I don't know. Another one, patients on Flomax, but says no to prostate problems. I'm not sure why you are taking Flomax, though, 'cause it really just does the one thing. And yes, women can take it also. No, they don't have prostate problems, but it kind of still sort of works in the same way. Oh, and then I said, hi, I'm calling to get you ready for the upcoming procedure with so-and-so. What will she be doing for you on Wednesday? She's helping me with my kidney stone. Oh, is she helping you with it? Uh-huh. Shining it up, babysitting it, polishing. What are we doing to it? She's helping me with my kidney stone. I'm not kidding. That's what, no side, no type of procedure. She's helping me with my kidney stone. That's what she said. I loved it. And another time, I don't know if the patient told me this or if it was written down that they took a liquid to drink. They were given a liquid to drink to dissolve the kidney stone. Acid. Did they give you some acid? Was it Drano? Did they give you some Drano to dissolve your kidney stone? Is there such a thing? Am I unaware of the liquid you could drink to dissolve a kidney stone? If anybody knows what that is, please do comment, because I'm very curious. Other than water to help flush it out, I don't know what liquid is not going to affect your esophagus, your stomach, your intestines, but yet be absorbed through the vasculature to go filter through the kidneys, which will then make its way somehow into the stone and dissolve it. I don't know what people think. Oh, but he also told me, this was the same guy. He was so sweet. And listen, I bet this guy could take an engine apart, put it back together, fix my bush hog, and make all my wildest dreams come true, clear my back five with, barely breaking a sweat while I, can't figure out how to raise or lift the bucket. Like, I'm not saying he's dumb. I'm just saying this is adorable. He says he gets short of breath when he gets exhilarated too much. That's precious. Exhilarated. You know when you get exhilarated too much and you get short of breath? You know what? I'm just assuming that's the one thing. When you're exhilarated, I'm thinking that maybe it's horizontal. I don't know. Okay, same as always, face your fears, forget your failures, follow your faith, and I'll see you next time.